Hi, my name is Pharmacist Chinedu, and today we'll be talking about the 5 myths about peptic ulcer. I'm going to be looking at this topic because peptic ulcer is very prevalent in our society, and that's why I feel we should talk about some of these myths. But first of all, what is peptic ulcer? Peptic ulcer is a wound that you can find either in your stomach or in your small intestine. Just like you're having a wound on your skin, but right now it's not on your skin, but in your stomach or your small intestine. Number 1 myth, that spicy foods cause ulcer. No, spicy food do not cause ulcer. Spicy food like garlic, ginger, pepper, onion do not cause ulcer. But what actually causes ulcer is a bacteria called Helicobacter pylori, or a prolonged use of painkillers like diclofenac, ibuprofen, aceclofenac, and pyroxicam. Those are the causes of ulcer and not your spicy food. Number 2 myth, that stress can cause ulcer. No, stress doesn't cause ulcer. But what stress does is that it produces a chemical we call cortisol. So what cortisol does over time is that it produces acid which can trigger your symptoms. So stress does not cause ulcer, rather it can trigger your symptoms. Myth number 3, that eating can prevent you from having ulcer. Oftentimes when we see prescriptions in the pharmacy and we ask people if they have ulcer, because there are some certain pain medications that one cannot take when he has ulcer, and we go on asking people if they have ulcer before we dispense medication, and sometimes the answers we get from them is that, oh, I cannot have ulcer because I eat a lot. I eat morning, afternoon, and night. But come on, eating does not prevent you from having ulcer. Like we stated earlier, the cause of ulcer is a bacterial cause called Helicobacter pylori, or prolonged use of some of your painkillers. So eating doesn't prevent you from coming down with ulcer. So myth number 4, that milk can heal ulcer. No, milk does not heal ulcer. But what milk does is that it can give you that temporary relief when you have ulcer symptoms like pain. But unfortunately, over time, the calcium and the protein content of your milk can help in the production of acid, which can irritate your stomach and trigger your symptoms as well. And lastly, number 5 myth, that all ulcers must come with a presentation of pain. No, not all ulcers come with that presentation of pain. Some of them you could just have bloated stomach, your stool could be dark because some ulcers can produce blood in your stomach or your intestine. So your stool, it's actually going to reflect in your stool. So not all ulcers come with that pain symptom, and that is why proper diagnosis and proper treatment is highly recommended. So thank you for watching. I will see you in my next video, but please subscribe to this channel because we'll be bringing you more health gist as the day go by. Thank you.